Hi, we're nursing students and we're just going to show an example of how we would change a dressing change in a home care environment. So the first thing you would do is come in and you would try to find an area that's appropriate to do the dressing change. You would talk to the client and find an appropriate spot according to their preference. You have to try to make sure there's adequate lighting and a clean spot to lay your supplies on. You'd also get a towel from them to put down to protect the floor from any drainage or like water coming from the NS. You'd also get a garbage bag to put the garbage in. And the first thing you would do is you would wash your hands. Okay. And before starting the dressing change, you would make sure to check the doctor's order. And in home care, doctor's orders are usually pretty vague. It would say change dressing 3 times a week. Sometimes it's a little more detailed, and if it is, you follow their details. There's also ET orders. Sometimes we refer to an ET nurse. So if there is a detailed ET order, you would follow that. If not, you have to base it on your own judgment and your own critical thinking to see what the appropriate supplies you would need are. So then you would come into the home. Everything's already kind of set up here. So I would get the things that I need out. Okay, then you would apply a pair of gloves. And you would remove the old dressing. Okay. Sometimes if it does get stuck, you can use some NS to loosen that up. Once you get the old dressing off, you just clean the area. So it's good to use some gauze just to catch the drainage. Make sure to clean the area well, and you're assessing at the same time. Okay, and then you would take some more gauze and you would dry the area. Make sure that it's nice and dry. And once you're done cleaning, you would change your gloves to a fresh pair. In home care, there's many things that you can use on wounds to aid with healing. Stuff that can absorb the drainage or antibacterial stuff that would help keep it from getting infected. For now, we're just going to cover it with sterile gauze. So you would open the package and you would make sure to only touch the back side of it. So you would never touch the front area, and you'd apply that to the wound. And I'm going to put an ABD pad just to catch the extra drainage. And then I'm going to cover it with cling. I'm just going to wrap it with cling to keep it there. It's always good to go over signs and symptoms of infection with a patient as well, just so that they know and they're aware. Things like redness, swelling, extra discharge, or pain, and also fever or chills. And that's it. That's a good example of how you change a dressing in home care.